Hi, everyone. Thank you for joining us for National NSSLHA's event, CSD Student Advocacy 101, Your Voice, Your Profession, Your Future. Tonight's event is designed to equip you with the foundational knowledge and practical tools you need to become effective advocates for your clients, your communities, and the profession. My name is Colin Sexton, and I serve as National NSSLHA's Vice President for Government Affairs and Public Policy. I'm a third-year audiology student at Purdue University. I'd like to introduce our moderators for tonight, Andy and Sophie.
Thanks, Colin. I'm Andy Rayuda. I'm a first-year speech-language pathologist graduate student at California State University, Long Beach.
Hi, everyone. My name is Sophie. I'm a first-year SLP graduate student at the University of Illinois at Urbana-Champaign.
This event is hosted by NSSLHA's IDEA Work Group in partnership with me, NSSLHA's VP for Government Affairs and Public Policy.
This is meant to be an interactive discussion, so please ask questions via the Q&A feature found in your Zoom bar. We'll address questions from the Q&A as well as questions submitted during registration.
And with that, I'd like to introduce our panel. Please introduce yourselves briefly, including your role and your advocacy experience.
Hi, everyone. My name is Gabby Howard, and I'm a pediatric speech language pathologist in Charlotte, North Carolina. My current advocacy efforts are mainly through the ASHA Government Affairs and Public Policy Board, where we develop the public policy agenda for ASHA members that highlights the advocacy needs of our members, like access to care modalities, healthcare coverage, early identification, and more. I've also had opportunities to speak with my state lawmakers' offices to discuss policies and their impacts. And I was also a very active member of NSSLHA and had some advocacy experience through National NSSLHA as well as my local chapter.
Hey everyone, my name is Kevin Cook. I'm a audiologist based out of Eastern Iowa, Western Illinois. I currently serve as ASHA's Vice President for Audiology Practice, and I'm a private practitioner audiologist at Quad Cities Audiology Consultants. Previously, I've served as the president of the Iowa Speech Language Hearing Association and treasurer of the Iowa Speech Language Hearing Association. I also served as the chair of the licensure board for speech language pathology and audiology within Iowa. So my advocacy experience really stems from not only looking at what bills are being passed, but what does that policy implementation actually look like from a licensure board perspective, as well as a lot of state advocacy and national advocacy as well through my various roles and capacities.
Hi, my name is Kevin Stutman. I'm the Associate Director of Federal Affairs here at ASHA. I've been with ASHA for a little less than 4 years. Prior to ASHA, I was at a bipartisan lobbying firm in DC where I supported clients with government relations support and strategic communication support. At ASHA, I help lead our appropriations lobbying efforts as well as our member engagement on the Hill. So I help run ASHA's annual Hill Day, and I help bring other ASHA members to the Hill, either in person or virtually, to conduct Hill meetings.
Hi, everyone. I am Doanne Ward-Williams, and I am ASHA's Senior Director of State Affairs. My role at ASHA currently is the lead on the team that monitors and tracks legislation and engages on state legislation and regulations that impact both professions of audiology, speech language pathology, and also impacts those that are served by the professions. My background is as a speech language pathologist, and I am an ASHA certified member. I started advocating as a student. So prior to coming on staff, I was on ASHA's PAC board as an early career professional. I was chair of the GAP board and was elected to ASHA's board of directors as vice president of government affairs and public policy. So advocacy for me really started as a student and then advocating as a clinician for my private practice, then as a volunteer member, and I have always been passionate and just now as staff.
Thank you all for sharing your experiences. So let's go ahead and get started. Our first topic is advocacy fundamentals. We have a few questions to get us started, but please start putting your questions on this topic into the Q&A feature. So for the whole panel, what is advocacy and why should it matter to CSD students?
Well, I'm happy to jump in. Advocacy to me is giving a voice to a cause to raise awareness or even to influence outcome due to its impact. It's important to CSD students because you're the future, you're the workforce, and your advocacy matters to issues that will impact the professions moving forward, to you being able to provide services and to ensure that consumers and the public are able to receive the services that they need.
I can jump in here too. So to me, advocacy is asking for and pushing for what you and your community needs to be successful. And as a student, advocacy is super important because it keeps you aware of what policies are affecting our ability to care for our patients, students, and families, even as you're training, which is very important because what affects you as a student may also affect you as a professional. And like um, Doan said, you guys are the future of the profession. So definitely being aware of those things will have a great impact.
I would like to add one thing to that as well. One thing that really ignited my passion for advocacy was looking at the issues that the patients we were running across on in the student clinic were experiencing when it came to poor reimbursement and coverage. Um, that was something that really had me looking towards what can I do to make a difference as a student. That actually drove me to my capstone project, which was finding ways to provide funding for patients within our clinic. And so I think a good element of advocacy is there's always something you can do. And it's one way that I like to channel my frustration of what's going on around me and channeling that into something that's positive for those that we serve.
I agree with everything that's been said so far. I guess as one of ASHA's federal lobbyists, my perspective is that advocacy is a First Amendment right that we all have to um, petition our government for things that for issues that we have. And I'll just say, one of the truths about this kind of work is if you're not at the table, you're on the menu. So you have to be involved. You have to share your stories and share how these policies, especially at the federal level, are going to impact you because it's not always clear to the people making these decisions.
Thank you all for helping us try to get an understanding of what advocacy really is. So, shifting the conversation just a little bit, what are some of the biggest advocacy issues facing CSD right now? Kevin S., we'll start with you to talk about some federal issues, and then Doanne, if you want to talk about some state issues as well.
Sure. So because audiologists and speech paths practice from twinkle to wrinkle, right? So we're from newborn to the elderly in a variety of settings, so healthcare settings, school settings, and so on. We are at the federal level engaged in many of the key healthcare and education issues. So things like Medicare, Medicare Advantage, reimbursement rates, early intervention, hearing screening, that kind of thing. So we're sort of across the board involved in all the sort of areas that impact the professions. I'd say for For CSD in particular, I'm sure you're all probably aware at this point, but last year Congress passed the One Big Beautiful Bill Act, and one of the provisions in that bill sought to create a new definition of professional degrees. And just to be clear, it's not that these professions are no longer professional, right? It's simply a way to save money on student loan costs for the federal government. So that's something that we're working on right now. We've been engaged in this discussion as the One Big Beautiful Bill Act was moving through Congress. We've been engaged with the Education Department. We are going to be submitting a two letters, one for audiology and one for speech path. The due date though for you to sign on to that would be February 27th. And then we're going to deliver those letters to Ed to make our opinions known about that. And even if the Department of Education comes out with a proposed rule that excludes audiology and speech path from the professional degree category, that's not the end of the story. So there's still going to be potentially a legislative fix. There are a few bills in Congress right now that we're supporting that would remedy this by including audiology and speech path as a professional degree, because this really is about the pipeline, right? If you're a current grad student, this shouldn't have much of an impact on you, but it's for the people coming into the profession or to the field. And so we need to make sure that we already have massive shortages especially school-based SLPs. We need to make sure that we can do everything we can to increase that pipeline and try to address that shortage in the long term.
So I will speak to some of the state issues. Across the states, there are a lot of issues that vary depending on the state. I'll just put them in a few buckets. One issue that one bucket would be licensure. So one would be deregulation of the professions, which is doing away with licensure within a state. The issue with that, of course, is that means anyone could be able to provide services that they're not educated and trained to do. So that would greatly impact CSD and having access to those that need services. Another issue within the licensure bucket would be scope of practice infringement. So other professions that are not audiologists and speech language pathologists that are not educated and uniquely trained to provide those services, being able to provide services and receive reimbursement for those services. And also telepractice requirements, which within licensure, there are specific states that have requirements that are related to telepractice. So we really engage on those issues that may cause barriers to be able to provide telepractice services within the state. Another bucket within some of the state issues would be reimbursement issues. You heard Kevin speak to some of that. On the state level, that is Medicaid and private insurance companies. So being able to ensure that services are provided and providers are reimbursed for those services. And then the last bucket I'll speak on for now is school-based issues. So looking at workload, caseload issues, ensuring that providers are not burnt out that are working within the school-based settings. And honestly, I could talk all night, but I will stop there.
Thank you both for kind of sharing your expertise in both of those areas and helping us kind of understand what some of those big issues are right now. Gabby, we'll turn to you. What are some common myths about advocacy, and can you kind of help us debunk some of those myths?
Yeah, so one of the most common myths is that advocacy efforts have to be these big, grand gestures, like, going to the Hill for your first time advocating or going to your state capitol. Advocacy does not need to be considered big to be impactful. So something small, like simply asking for a replacement for one of your most popular games at your clinic site is a small advocacy effort that has a huge impact because we know your kids are going to be more excited and they're going to be more motivated during sessions, and they're going to make a lot of progress that you want to see. Um, Another myth is that you'll need to be a policy expert in order to advocate at the state or federal levels. You do not at all need to be an expert, but you definitely should be familiar with what policies are affecting you. And the last one I'll mention is kind of going back to specifically being a student when you're advocating, is this idea that because you're a student, you're going to make less of an impact. That's not true at all. Like we said, you're the future of our profession, and your impact is far greater than you may believe because you see and understand what's happening right now and how that will affect us in the future. Whereas people who may have been in the field a little bit longer may not have that perspective. So your fresh perspective is very valuable.
Thank you for sharing some of those myths and helping us kind of understand and navigate through that. Sophie, do you have any questions to share from our audience?
Let me check. So we just actually got a question. I see Joanne's working on one of them right now, but someone said, what would you say is the best way to get more people to advocate? I know there's letters and ways to send those links to people, but what's the best way to help people actually take action? And I can field this maybe to Kevin K if you want to talk about this a bit.
Yeah, so the letters are definitely something that you can do. They're quick, they're easy. I always recommend on the ASHA Take Action letters that you add a little edited point about why it's relevant to you or the patients you serve. But the best way to get more people to advocate is to simply just to contact your legislator, reach out to them. Most of your legislators have town halls that you can go to, and they're often on the weekend or really accessible or at a public library. Sometimes they'll have a coffee hour. And as students, I think that's a really good informal way to meet them and see that, yeah, they're people too. Though they may have what seems like a scary job, and they're making really big impact, but they're people. And ultimately, what they want is to engage with their constituents, especially lively young people who are from where they represent and want to work and stay where they represent, even if you may not want to, but tell them. Um, but I would say the best way is just to get involved, follow your social on social media, and they'll show where they're going, and that's a really easy way to get involved with them. And it's not as scary, and usually it's somewhere pretty close to you.
Kevin, thank you for sharing that. I agree. I think legislators are always happy to meet young students like us who they're always able to talk and they really enjoy that. Um, Andy, do we have any more questions in our Q&A box?
We do have the one that Joanne is typing an answer to right now. Um, but please go ahead, keep giving those questions. We'll go ahead and we'll get to them in a bit.
All right, we'll go ahead and move on to our next topic for this evening. Our next topic is advocacy skills and real-world application. We have a few questions to get us started, but please again start putting your questions on this topic into the Q&A feature. So first question being, who are the decision makers that impact our profession and clients, and how do you engage them at local, state, and federal levels? And again, for this one, we'll start with Kevin S. and Joanne to talk about their respective levels there.
Sure. So at the federal level, obviously, Congress and the administration are going to be the key decision makers. Um, so the lawmakers themselves, as well as their staff, are going to be very important. And there are, the House, each House member is up for re-election every 2 years. So there is quite a bit of turnover every 2 years. So my team, for example, will when there's a new Congress and freshmen get sworn in, we'll go meet with those offices to introduce ASHA to them, introduce the professions, offer to be a resource, and make that first touch point that we can then leverage later on, down the road as we see what that member's interests are. We have at ASHA, we have an entire team dedicated to working with the regulatory agencies, so HHS, CMS, Department of Education, and so forth. That's where a lot of the sort of nitty-gritty work happens. But it is important to make those initial connections so that we can introduce ASHA and make sure that there is an understanding of the value of the professions to the best that we can. And I also would say that yeah, it kind of in a different sense. I would say ASHA members are also key decision makers. We put out an annual survey to all of our members to solicit feedback from them on what the main issues are that they're facing in their career, in their workplace and so forth. And that survey is what the GAP board uses to develop the public policy agenda. So that determines what we advocate on. So it is really important for ASHA members to be involved in that process to let us know what are the key pain points that you all are experiencing.
So some of the decision makers at the state level are state legislators. So state legislators introduce bills that support access to services or can protect scope. They can expand or limit telehealth delivery. Sometimes state laws can set Medicaid coverage rules and affect private insurer mandates for audiology and speech language pathology services as well. And also those laws by state legislators also can relate to school services, so they can influence how speech language pathologists can deliver services through IDEA and state education policy as well. Also, we engage with state legislators. It really depends on the state, the issue. On the state team, we like to say, when you've met one state, you've met one state. And I feel like that is true. So it really does depend on the issue, the state, and what is needed during that time. So we can engage in meetings. We may engage through also through our state associations because we partner with them. Other decision makers are also state licensure boards. So state licensure boards, as you heard Kevin talk about earlier, the other Kevin talk about earlier, they ensure public protection, and they establish and enforce minimum education requirements and experience standards for the professions. They also establish scope. So changes to licensure requirements can really expand or even restrict entry into the profession. So our engagement with state licensure boards are really to share information, just to make sure that they have information that we can offer as far as resources and different things. We do not influence state licensure boards, so I think that's important for you to know that the state licensure process and the ASHA certification process differs. And so those are two different things. So we like to build rapport and have a partnership and just have rapport built with state licensure boards. Other decision makers at the state level is also payers. So we talked about Medicaid and private insurance companies. They make the decisions on what services they will and will not cover and how often. And that really impacts how providers are able to provide services. School-based members, sometimes decision makers really depends on your setting. So for school-based members, that looks like their principals, school districts. They set those kinds of decisions for them. Those that are in like private practice and healthcare, they have different decision makers depending on where they're providing services. And one decision makers that I think it's important to remember too is parents and caregivers. That parents and caregivers, even if you've gone through all the other decision makers that have been talked about, if they will not sign that permission form, then you will not be able to provide services for their loved one. So the way we engage with parents and caregivers is honestly being able to share information with members and providers so that they have resources to be able to share with families so that the public knows about speech language pathology and audiology and the importance of those services.
I did want to add one shameless plug for your state association. Your state association needs students to engage with them on issues going along with your state. So look up your state association, contact them, be involved. They will put you to work and they need you.
That is a very good point. Thank you for bringing that up. So what is the best way for someone to begin advocating in their community? Often as students, we often don't know what the first step looks like on how to get started. So, Gabby, if you want to answer this question, so kind of help us understand what is the best way for someone to get started in the advocacy process.
Yeah, of course. So you can start by looking at the needs of your patients and families and think about what will help them make progress towards their goals, what will help them be the most successful. And also consider what you need to do your job effectively and why. And this can vary from person to person and situation to situation. So I think the best way to really start advocating very baseline is to figure out what exactly you want to advocate for and who you may need to contact to help you make that change. So figuring out your why and brainstorm some possible ways to help you achieve that goal. And then think about who you need to talk to get your message across. So it could be your professor, it could be your CI, it could be even your other classmates. And I think that's a really good way to help begin your advocacy journey. And I also think that NSSLHA does a great job at making advocacy easy and accessible for students. So getting involved in student advocacy days, going to your local chapter meetings and seeing what are some advocacy things that they're doing is a great way to get started as well.
I agree. Those are all very simple, easy steps to go ahead and get started on the advocacy journey and kind of make it feel a little less intimidating and scary. So thank you for sharing those. Doanne, we'll come back to you for just a second. So now that we know how to start advocating, how do you advocate on issues kind of across the states?
So advocacy really differs across the states and it depends on the individual issue. So always being proactive is the goal. Being able to reach out to your legislators and reach out to your decision makers to let them know your expertise, that you're there, so that if there's ever a decision that's coming through or an issue that comes up that you can speak to, you could be a person that they could reach out to. And that can happen and does happen whenever you build rapport with your legislators and decision makers. There's some issues that are very individualized, and advocacy really depends on that particular issue. For instance, DEI, members experiencing DEI in the states, it depends on your state law and how you engage. It depends on your employer policies as well. So it's difficult to say exactly what to do in every specific situation because everyone is different, but just know that there is, ASHA is here to help and to offer individual advocacy tips and strategies depending on each individual issue. But also partnering with your state associations, as Kevin talked about. State associations really are the boots on the ground in the states. Their awareness of what's happening, issues impacting members within those states is so important. And I know as ASHA, I'm so grateful for the joint advocacy efforts that we have with state associations. And I think that for students, being able to join and become active with your state associations is a great way to learn about advocacy with mentors and be able to have that mentorship as well.
Thank you for sharing that. So now that we know the best way to get started and kind of how to advocate for these issues, Kevin Kay, we'll turn to you for a second. So how do you begin kind of crafting your advocacy message and kind of getting your point across when you're talking to legislators?
That is an excellent question. So there's a lot of different ways you can go about crafting your message, but the most common way that people like to use is their elevator pitch. So if you had to say really quickly in a brief minute, if that, hi, my name is this, I am from this place, And I'm really concerned about these issues that are happening within our state. Um, then you could say, for example, I worked with a family, they were really having trouble with hearing aid coverage, and it ended up taking months and months for them to save up funds to be able to afford hearing aids um, because of lack of insurance reimbursement. And that's why I want you to take action for X, Y, or Z, this bill. So an elevator pitch is a really easy way to craft your message. I think it's really easy to have a formula. Um, but I also think it goes back to Gabby's, what is your why? What are you advocating for? And really highlighting the families that you're working with, the patients and clients you're working with. And better yet, if you want to bring them along and help support them with that process, no one knows their experience better than them. So, and I encourage you to collaborate with them on crafting a message that makes the most sense for you. So the easiest way is an elevator pitch. And if you go to a Hill Day or you go to some type of event, often your state association may have a resource or a training that tells you how to craft that message. But overall, it's you telling briefly who you are, why this issue is important to you, but also you're going to want them to take action. What can they do to help you? And that could be supporting Bill X, Y, and Z, or that could be, hey, would you be interested in sponsoring legislation with our state association? Um, that there's a number of ways you can go about it.
I agree. The elevator pitch is kind of the one that I've heard most commonly, and it's pretty easy to have just a 30-second, 45-second kind of intro to yourself and what your why is that you can pull out at any time. So I definitely encourage you all to kind of create your elevator pitch for when you start advocating. Andy, do you have any questions to share from our audience?
No questions right now that are going unanswered. We do have Doanne and Gabby hard at work typing their answers. So please just feel free to keep them coming. We'll go ahead, we'll address them live, or we'll have those in the chat for you.
Awesome, thank you. So while Gabby and Doanne are kind of working on those questions, we'll kind of transition to our final topic for the evening. Our final topic is focused on resources and next steps. Again, we have a few questions to get us started, but please put questions into the Q&A feature on this topic. So Gabby, Doanne, while you're working on those, Kevin S., we'll start with you. How can students get involved in ASHA's advocacy efforts?
Sure. So we've touched on some of the ways already. You can always write or call your member of Congress at the federal level, or engage with your state lawmakers, or your school district and so forth. But so you can attend a town hall, as the other Kevin mentioned. A lot of those can also be done virtually. And if that's something you're interested in, we would, you know, or my team would be happy to help you craft a question. Should you get the opportunity to ask one during a town hall. You could always participate in Hill meetings, either in person in DC with us or virtually. We take a lot of care to make it as painless a process, and as uh, easy an experience. So from my perspective, we want, repeat customers, right? So if you're gonna take time out of your day, if you're gonna come help us do our job to help advocate for the professions, we want to make it as easy as possible for you. We're going to make sure that you're as prepared as you feel you need to be. We can be in the meeting or the call with you to help facilitate the conversation. Um, and then I would also say, encourage your, classmates, others in your life to get involved. You don't have to be an SLP or an audiologist to, take action on through our website. These issues impact a lot of people beyond just the professions, but including all the people that you all serve. But I think for students, I think, you guys are super busy. I think the most important thing at this point in your career is to just try to stay informed about what's happening. There was a lot of big policy discussions happening at both the federal and state and local level that are going to impact your career, your workplace, your ability to provide the services that you do. Um, and so just be aware of what's going on and just be informed. And I think that's just one of the easiest ways, one of the best ways to get into advocacy is to know what the issues are. We have a robust section on ASHA's website, ASHA Advocacy or ASHA's .org/advocacy. We do little quick news pieces that touch on the main things that are happening. We do a bi-weekly ASHA advocate that goes over some of the high level policy developments, other things that have been happening. Just to be aware of what's happening because if you don't know what's going on, you're not going to be able to help address it, right? Um, yeah.
I agree. Staying in the know and kind of being current on these topics is a big part of this and being involved in that advocacy process. But staying on top of all of that and the current legislation, especially when things are very fluid, can be kind of overwhelming. So, Doanne, how do you stay current on legislation and legislative changes, and updates without getting overwhelmed?
Well, I'm not sure if I have an answer for how do you not get overwhelmed, to be honest, but that's my job. So take walks, take deep breaths. No, it's a lot. I mean, as far as state legislation, we at ASHA we use a state tracking platform, and so we have all of the bills, especially this time of year. You know, state legislative sessions mainly go January to mid-May, and that's the really busy time. I believe the figure said last year by June there were over 30,000 bills that were introduced across in state legislatures. So it is easy to become overwhelmed. But one thing that ASHA offers to those with an ASHA login is to be able to get updates on state legislative and policy updates. So there is a site, I saw it was just dropped into the chat, thank you, where those with an ASHA login can go in and to not get overwhelmed, you can just go to the map and look at what's happening in your state or you can choose to look at a specific topic. That way, you are getting possibly bite-sized pieces of what's going on, and you can control how much you're getting at one time. But with that policy tracker, you're able to see what ASHA is tracking relative to speech language pathology, audiology, and any other policies that may impact providing services, and it's within a certain time frame. You can choose the time frame. Generally, is the current legislative session. Recognizing that some states may not be in session this year, but I think that's a great way to stay current on it. Also, you're also able to see if ASHA has engaged on it, if we've written a comment letter. You're able to see that as well. But it really gives you an opportunity to stay current on what's going on because you can follow a bill and see if it has been introduced. It could, if it went into committee, if it failed, things like that. So you'd be able to really follow what's happening in your state and what would impact you and where it is in the process.
Awesome. Thank you for sharing some of those tips. Um, Gabby and Kevin K, I don't know if you have any other tips to kind of stay on top of advocacy and legislative issues without getting overwhelmed that you want to share?
Yeah. So sometimes, especially with certain bills, I've just had to email my state lobbyist once a week and just set a calendar reminder for some of those really big issues. Uh, but I would say many state associations work with a lobbyist, so that would be a great way to start. Your state associations have newsletters that will talk about key issues. So I think your state association is a great way to key in on where you really need to take action. Again, following them on social media, reading their actually clicking, opening up the email and reading through it. Because sometimes they'll say we really need our SLPs and audiologists to take action on this bill right now. Um, and so while that seems overwhelming, I just view it as part of just my due diligence. And one way I easily do that is by adding it on my calendar once a week or every other week, whatever my capacity is, just to follow up and take a look at what's going on in my state.
Yeah, I completely agree. I subscribe to the ASHA Advocate, so I am up to date with what's going on. Something else that I do is at work, I'll actually sit down with my director and assistant director and talk out how these policies would affect us in our clinic and just work through it that way. And that kind of helps to keep me calm and grounded, as well as up to date.
Thank you both for sharing those tips as well. I'm sure we have a lot of other student leaders on the call tonight who may be wondering, what can their chapter be doing to promote advocacy within our field? So, Kevin, what can a chapter be doing during a meeting to promote advocacy within the CSD field?
So, the beautiful thing about a chapter is you have a wonderful community that's with you to support you. You don't have to do anything alone because you have someone right there by your side. So, different chapters will work differently. So, some of you may put points for different advocacy initiatives that go towards cords, graduation cords. Other people will say, you know what, let's do an education session to our patients and let's reach out to those that we're working with in our student community and put on an event where we discuss and explain Medicare issues or Medicaid issues and why that's important for them. So, educational sessions can be helpful. Take a moment in your meeting, especially if you know there's a take action that needs to be done. You can put a meeting and tell all of your members, here's how to take action. Let's all write a letter, or let's write a letter together and all sign off. And sometimes I think it'd be really cool if you invited your legislator or went to a town hall together. Um, they would love probably the opportunity for the photo op, but they would also love the opportunity to engage with you. Um, but I would say the best way to do it is to schedule it and plan it into your agenda items. And maybe if you're on the board or council or however your structure is, to set up an advocacy on 101 with the resources you've learned today or the ample resources that ASHA and NSSLHA has on advocacy. Um, and I know I also teach part-time at a university, so I encourage my as a teacher, I say, hey, go like if you want a little bit of extra credit, do an advocacy thing and write a report on it. So maybe convince a teacher to help you or work with your advisor. There's a whole lot of options that are available to with you, and the more creative you are, the better.
Yeah, all those are really great ideas that chapters can be using to kind of implement into their meetings to spark this advocacy conversation. One of the barriers that we often hear about is, advocacy takes time and we're busy students. So Gabby, how can we encourage our peers in our programs and provide opportunities for advocacy that fit into these busy schedules?
Yeah, so I definitely understand that with your clinic and class schedules, advocacy is probably not always at the forefront of your mind. But by discussing the changes you may want to see or policies you've even heard about, can encourage your classmates to also start considering, like, oh, I didn't know that was going on. Maybe I should look into that a little more. Oh, wow, this is happening at your placement. Same thing is happening at mine. What can we do to change that? And then you start, talking to each other and brainstorming, and word of mouth is a definitely powerful tool you can use to spread awareness to your peers, that won't take up too much of your time, but will also begin to spark those conversations, regarding your advocacy efforts. Um, so yeah, I would say just encourage. starting by talking. And this can be just going to and from class, or maybe you got the email from NSSLHA or from ASHA, and you send it to your class group chat. So then now people are aware of it. So then therefore you can kind of start to plan, well, what can we do to put forth some effort here?
Awesome. Thank you for sharing that. I believe there was a question that was dropped to the Q&A that Joanne, you are working on and would be willing to answer live for us.
Yes. So I'll read the question. It says, as a former travel SLP, I'd been very eager to see the Interstate Compact move forward for what felt like years. When I started the licensure process here in South Carolina, just recently after stepping away from clinical for PhD coursework, I was surprised to still see it was just on the cusp in so many states, South Carolina included. Even still, for organizational issues that seem to stall and hover on the edge like this, how can students, clinicians help with that final nudge on sweeping changes? Well, I will say, in reference to the Interstate Compact, so South Carolina passed the Interstate Compact back in 2021. So, yay, that was a big win. The challenge at times is that you can do all of your advocacy and you got it there, but then it goes to another step in the process. So, for instance, with South Carolina, you've advocated, you've gotten it. Now it goes over to where the licensure board needs to onboard to a system called Compact Connect. And so Compact Connect is what is the system where all licensees' data and information goes so that they can be shared out. So it's not stalled necessarily. It is just in a different part of the process where you don't necessarily have influence at this point. But we are seeing that states are onboarding. So it's very exciting. Last week, Ohio became the third state that began to issue privileges to practice. So that's very exciting. So West Virginia, Louisiana, and Ohio now are not only past the Interstate Compact, but also issuing privileges to practice. So just know in some spaces, you've done all you can do and it just goes to a different part of the process. I will be honest, there is spaces where legislation does stall or legislation dies. And what happens in those spaces is you continue to advocate, things can be and bills can be reintroduced in the next session. So that's why it's so important as a student also to be able to work with your state associations because they have a lot of power to be able to help get it reintroduced possibly in the next session, especially if they have a lobbyist, but being able to work with a larger network if things are stalled or if something fails in one session, being able to work together and be able to support it being introduced in the next year. So I say don't give up. Either it's in a different part of the process or may need to start the process over and keep going because with legislation at times it may not go through during that very short legislative session. So in the states, it's different where some states may have a session from January to December. Some may have a session that's only 30 days long. And so just know that you have to be impactful, work really hard, but don't give up because you can always continue to work more in the future, reach out to your state associations, reach out to ASHA where we can provide resources to you. We can help you figure out what happened. If something stalled within a committee for a certain reason, we can try to figure that out with you so that we're able to see what we can do in the future. So keep trying.
I would also like to add on. So literally right before this meeting, Iowa passed the Interstate Compact, and they've already put the proposed rulemaking, and now there's a comment period. So please read the code if you have any consideration, make comments. Know that your licensure board is composed of speech pathologists and audiologists. The Interstate Compact has delegates who are audiologists and speech pathologists who are on the licensure board, and these people care about our professions. to help it cross the line. But a brief story about the state of Arkansas, there was a scope of practice modernization bill that they had a student there actually as a speaker when they were proposing this bill, and it eventually got passed. And one of the compelling pieces was the student saying, "Yeah, if I can't practice here, I'll just move to another state and I'll practice there." And that was really compelling for a lot of people, and ended up getting that bill passed. So that could be something as a student saying, yeah, why would I practice in this state if we don't have compact privileges when I could go to our neighboring state who has already signed on and work there and work in a bunch of other states as well. So that is very compelling because legislators want you to stay in their state. They want you to work in their state, and they want you to serve their constituents.
All very good points. Thank you both for sharing. Final question kind of to the whole panel. At what point in your career did you feel like an effective advocate? And what advice would you give to students who don't feel, qualified to advocate yet?
I'm happy to jump in again quick. Um, so I would say the work of advocacy is a continuous thing. But I think the moment for me where I felt like an effective advocate was when people started coming to me asking questions about my thoughts on bills. And one thing I'm particularly proud about is in the state of Iowa, because of a lot of due diligence, we were able to turn a bill that was going to deregulate and de-license audiology and speech pathology into a bill that allowed audiologists to practice without needing a separate dispensing license. And I think that was something where I actually see this really big change, where a lot of audiologists were frustrated about needing this additional licensure. It was an administrative burden, a financial burden, and seemed just redundant and ridiculous. And the fact that literally spending hours and hours of time, but it actually paid off. And the bill, which was very scary at first, and I could have given up, or our group could have given up, but because we tracked it, we were able to really pivot it in our favor and make a real meaningful change.
I can, excuse me, I can take the second part of the question there about any advice to give students who don't feel qualified to be an advocate. I mean, to me, it's not an issue of being qualified, right? Like you should feel empowered to be an advocate. We always say this, like our members and you as students really are our best advocates. Either are way better than my team because you guys understand the issues at a from an on the ground perspective that like I as a non-clinician could never really get, right? And it's, at least at the federal level, members of Congress and their staff, part of their job is to hear from their constituents. They want to hear from you. And I think as Gabby said earlier, you don't have to be a policy expert. Nobody expects you to be a policy expert. The value you can bring in federal advocacy, just in particular, is to explain to who you're meeting with or talking to how the policy is going to impact you. They're not very good at understanding always the downstream effects of policies that they're passing. So to be able to go in there and just say, hey, if you don't increase the Medicare physician pay, fee schedule, so if my Medicare reimbursements don't go up, I'm going to have to lay people off in my practice. I'm going to have to, not see Medicare patients or even close my practice. So giving basically sharing your on the ground perspective is really what's valuable. And you are qualified to do that. And you should feel empowered to do that.
I want to share about that last part as well. Whenever I used to do heal visits prior to coming on staff, I used to feel nervous and was like, oh, am I going to be able to share this? And one of my mentors told me that I should not be because no one knows your story better than you. And that's true. When you go in, you are either giving a voice to those clients, patients, and students you're working with, or you are sharing your daily story. And no one does know that story better than you. So, um, everyone is qualified because everyone knows their own story. And so, being able to go in and share that, um, there's always numbers, there's always data. If you need to share that, reach out to ASHA. We can share it later. We can give it to you. But your job to go in there is to talk about your daily experience. What are you seeing in your practice? What are you seeing at your university? Share that story. And no one else in that office knows that better than you. So,
So I'll kind of share my perspective from a little bit of a smaller scale, really the workplace. I would say I started to feel effective fairly recently, and it's been about 2 years after my CF year. And I think what contributed to that feeling of effectiveness was seeing the changes that I asked for and the positive outcome of those changes. Seeing how my kids were affected, my families were affected, changes that were happening in their schools that were helping them to be able to find their voice and communicate effectively and all of the things that we work so hard for definitely helped to make me feel effective as an advocate in my workplace. And the advice I would give to you as students would be to give yourself some grace and give yourself time to grow and develop as an advocate. These aren't necessarily skills that are going to come to you overnight, but they are skills that will grow when you actively seek out to gain more experience.
Awesome. Thank you all for sharing those tips and um, how to help us as students start to feel qualified and feel empowered by this process. So, on behalf of National NSSLHA, we'd like to thank our panelists for offering their time and expertise this evening. This was a wonderful discussion, and we'd appreciate your feedback via the event survey link in the chat. We encourage you to practice your advocacy skills today by signing the ASHA comment letter and sending take action messages about the Department of Education comment period around federal student loan limits. Also, be sure to join us for one of our upcoming events. It's only with the help of our dedicated members that the CSD community continues to thrive. This conversation has been recorded and will be posted on National NSSLHA's website and social media accounts. Again, thank you all for joining us and have a great night.